Hello and welcome to Woodbridge, the best town around. My name is John McCormick. I'm the mayor of this great town. And we're here today at the start of our annual Health Expo at the Woodbridge Health Center. To my right is Dennis Green, the Director of Health. We're joined by several council people. To my far left, Lizbeth DeJesus, Councilwoman at Large. To my left, Corey Spiller, 3rd Ward Councilman. And to my far right, Kyle Anderson, Councilman at Large. And let me start with Lizbeth, since you're on the far left. This is your first health fair as a council person. Have you come before? Do you know much about it?
Yes, I've come before with my family. I think it's a great event here in Woodbridge where you can learn about all the services that Woodbridge Township provides, but also there's a ton of information about a lot of health issues, and it's free. So for the children, for the elderly, it's a great time. You can come in here and get tested. I believe your blood pressure can get tested. You can get information about the flu shot, and you can get a ton of information about nutritional events and also about nutrition for the kids, which is very important with the obesity epidemic that we have in our country now. So if you have time, just come over and stop by. And if you miss it this year, make sure to put it in your calendars for next year.
Okay, Corey, try to top that.
I really can't. Thank you, Mayor. I want to thank Director Green and his staff on a great program they're running here. As Lizbeth said, we have flu shots, so many vendors here offering their services. It's just a great time, so come on out and enjoy. We're here to 9 to 12 today.
Okay, Kyle, before I turn it over to Dennis, anything you want to add?
Well, again, thank you, Dennis, and to his staff. They do a fantastic job of not only keeping everyone healthy in this town, but keeping them informed of the services. Working in the health field for the last 15 years, it's very important because education is everything. I tell people all the time, you go out when you shop at ShopRite, what do? Do you shop the aisles? Do you shop the perimeter? If you shop the perimeter, that's where all your healthy foods are. But it's just a little bit of education. Things like that, people walk away and they know more about it. As Lizbeth pointed out, knowing your numbers, getting your blood pressure checked, know what your A1C is. I'm pre-diabetic. I have to watch what I eat. So know those numbers that are so vitally important to you. And today's a great day to come and learn about your own health.
All right, first of all, before I go to you, what do you mean the perimeter? What's that all? I never heard of that.
Where all the fresh foods and all the frozen foods stay away out of the aisles because that's where all the preservatives are.
That's where but the freezers and the cold stuff's on the outside.
All the fresh things.
Did you know that?
I was just testing you.
I didn't know that. I never. I mean, now that you think of it, yeah. Everything cold is around the outsides.
Yeah.
All right, that makes sense. I guess I don't go to supermarkets very often. No. All right, so Dennis, this is it's almost like an unheralded resource, this health fair. It's great. We just took a ride around and talked to everybody. You've got not just a township, but what I love is there's other government entities that people wouldn't even know exist, like the county health department. That's an untapped resource for people. Tell me about all the vendors.
Absolutely, Mayor. Thank you. And yes, the Mayor's Annual Health Expo is the 3rd Saturday of every October. And we're located at the Health Center, right between the high school and the library. The Woodbridge High School and the Woodbridge Main Library. So we encourage everybody to come every year. So we have different things every year. So this year, we have a great selection of different whether it's medical facilities, any healthcare related, or even other public agencies like the Sheriff's Department's here, the county health department's here. We have SNAP here from the county. We have pharmacists, dentists, doctors, hospitals, agencies that provide chronic disease management. We have a lot of different great resources here. Great screenings. You can get free screenings, which is terrific. I mean, we have some great council people here, and obviously they're very educated about health, and so they shared some of that information with you. But we have a lot of different educational opportunities and screening opportunities, whether it's eye screening, hearing screenings. We want people to take advantage of it. If you can't get this on your own, if you can't afford it, we can get it for you here, and you can come here and you can get it free. So we really encourage everyone to come here every year, and we also have another event in the springtime called Public Health Day, which we do a very similar thing. So we really bring a lot of these agencies together. They donate their time. It's free. The doctors donate their time. The agencies donate their time. So this is all free, and we want people to come and take advantage of it. The only thing that is a charge is that we do blood screening, so you can get a full blood screening at nominal cost, and we do that every year here also.
Now, if somebody's watching at home and can't get here, how do you recommend they find out about what's available from like Michelle Morgan's group, the Office on Aging, and tell me how somebody's just a senior, maybe homebound, maybe just not mobile. how do they get a hold of us?
Obviously we have the information on the web. If you go to Woodbridge Township website, we do have a whole section on the health department and all our different agencies and what services they provide. But they can call up 732-855-0600, and 5025 is actually my office. You can call up there if you have a question, any type of health-related question or services. We'll put you in contact with the proper agency or department, and we can get you those services.
A little slower on the phone number.
732-855-0600, extension 5025.
So make a note to Lee. Tell Lee to put a scroll underneath there so people can have that. Yeah, because it's very important, because a lot of people just can't get here. And a lot of people don't have computers. So it's a simple phone call to you, and you can walk them through or refer them through. Michelle makes house calls, our whole group. They go out to see people. We can hook people up. You can talk about tooling around the town if you're home and you're not able to get work done. Many times elderly widows, the husband used to do all the work. That doesn't happen anymore. We have the Tooling Around the Town program in April. You can call Town Hall and ask about that to the main number, 634-4500. And you go right to the mayor's office, extension 6015. That's available. There's just all kinds of things that we have that people don't know about, and we can get out there and talking to you, talking to us, talking to anybody in the council. They can find out what those services are.
Absolutely. And, if you do come to Public Health Day or the Health Expo, all the health department agencies and staff are here, so you can actually talk to any one of them. They all have a table. You can walk around if you have questions, and that's what they're there for. They're there to provide you the information and answer your questions. But yeah, absolutely, we have a very diverse department, a number of different agencies that do different services. So if you have a question, definitely call. We'll put you in contact with the right person, or try to stop by one of our health events, and we can put you in contact with the right person.
Talk about what Michelle's group does, because they're in the field. They're never in the office. They're always out visiting people. Tell me about that and how do people learn about that?
Excellent. So Michelle's group is called Multi-Service Division on Aging, and what they are is they're social workers. The social workers actually help the homebound senior citizens, and what they do is they actually do home visits and go out and try to get them the services they need. What we want to do with the seniors is try to help them live a healthy, more vibrant life within their home, so they don't have to become institutionalized. So if we need to help them get some type of health aid or some type of aids or Social Security or whatever services they need to help them live a more active and well life, that's what we want to do, and that's what the social workers are there for. So they do home visits. If you have any questions, give them a call. They're located at Evergreen Senior Center, and they work actually very well with the two new seniors, the Evergreen Senior Center and the new Sycamore Senior Center. And what we do is we do programs there too also. And one of the things that they do is very important is socialization. They want to bring people out and get them out of their homes, socialize with other seniors, and so they have a more vibrant mental health as well as a physical health.
So if you're homebound and you're watching this, we can send someone out to talk to you, and if they can't help directly, they can find who does. That's what I think is very important. They know all the federal agencies, they know all the state agencies, they know all the county agencies, they know all the private agencies, and they can hook you up with whatever services you need. So that's very important if you're watching this.
It's a great service.
It really is. It's an untapped resource. These ladies are out all the time talking to people, visiting them in their homes, and a lot of people don't know that. So please call the main number. Give it again,
732-855-0600, extension 5025.
And that gets you right to the top. Well, not the top, I'm the top, but it gets you almost to the top. It gets you to the next tier. But you can call me too, 634-4500, main number, extension 6015, and you get to our office too. And there's a whole bunch of very dedicated workers who will take care of whatever you need. So, Dennis, congratulations on another successful health fair.
Thank you, man.
Great job.
Make us look good all the time. Thanks for watching.
Okay, and we're here now with Judy from Kinder Pediatric Urgent Care. We're going to ask Judy to tell us a little bit about what she has today and a little bit about her facility.
Sure. We're located on 530 Green Street in Woodbridge. Instead of going to the ER, or if your pediatrician's office is closed, you can always come to us. We offer in-house labs. We have an on-call x-ray technician, and we also have board-certified pediatricians on staff at all times. Starting November 1st, we have extended hours on weekdays from 12 p.m. to 11 p.m. and weekends from 11 p.m. to 10 p.m.
Okay, so Judy, so you have this nice facility. So the intent of the facility is what? To make it easier, more convenient for care for our younger people, like the children, right?
Right, absolutely. It's definitely a different alternative. We're known for our lesser wait times and lower copays than the ER.
Okay, great. And so you're located where again? So tell us again.
530 Green Street in Woodbridge.
Okay, great. Thank you. And now we're here with Amanda and Dr. Quadri from Family Dentistry.
Lake Family Dentistry.
Lake Family Dentistry. Thank you. And so they're going to tell us a little bit about why they're here today at the annual Mayor's Health Expo and what we can expect from them in the future.
So this year, this is I think our third year participating. This year what we did is we kind of decided to bring the office to the expo. So we've got the capability here to do a complete dental exam outside of x-rays, because it's a little hard with x-rays, but we're taking a look at people's teeth, kind of helping them get another opinion or option. A lot of the people here typically are repeat customers. They come every year because they don't have insurance and they're trying to find low-cost alternative. So we're trying to help out the community and participate as much as possible.
Well, that's terrific. We appreciate you coming here today. So I see you have lots of interesting equipment, and you have a TV screen.
Right.
And I know you're donating your time here, so we really appreciate that. And you're coming here and you're taking your time, which is very important. And that so people can come here and talk to you, and then you can look at them and do a mini exam and give them an evaluation of kind of where they stand in their dental needs.
A lot of people are very curious about teeth because they hear something from one dentist and sometimes they don't know what to believe. So we do a lot of consultations and kind of basically help people understand what they're going through and what can best help them look better, feel better, and be healthy.
Great. I know a lot of people are apprehensive about going to a dentist.
Yes, they are.
So it seems like you have a really nice bedside manner, so to speak.
Thank you.
And I know you try to put them at ease a little bit and try to talk them through it. And I guess a lot of education and explanation really goes a long way.
Education is the cornerstone of our practice. Nobody walks into our practice knowing everything, and we make sure they walk out knowing exactly what's happening in their mouth.
Well, terrific. Thank you for coming today.
You're welcome. I appreciate it. Thank you so much.
Okay, and at this table we're here with Giselle from SnapEd. Giselle's going to tell us a little bit about her program and why she's here today.
All right, so good morning, everybody. As I mentioned, my name is Giselle, and we have here SnapEd. Our purpose for this program is to provide nutrition education to those that are eligible or are receiving SNAP. So the little presentation that we have here today as one of our many is to advise people or to show people how much sugar are in some of these beverages and to make them aware of the sugar content. And that being said, to help them lower or make healthier choices when it comes to these beverages.
Okay. And what does SNAP actually stand for?
SNAP stands for Supplemental Nutrition Assistance Program. It was formerly known as food stamps. So they changed
Okay, great. So your goal is really to help people learn more about their foods that they're eating so they can make healthier choices.
Yes,
and so I see you have a lot of different samples here, and I guess, are people surprised sometimes to find out maybe the sugar content or some of the other contents of the products?
Yes, they are very shocked. Sometimes they give me, oh, well, it doesn't taste so sweet, and then they realize how much sugar is in actually in some of these beverages. So I hope they take away some of this information and make healthier choices. Consume more water, a bit more hydrated in that term.
Okay. Well, great. Well, thank you for coming today.
Thank you for having us.
Okay, and at this table we're here with Mark from JAG. So, Mark, tell us a little bit about why you're here and what your program's about.
So we're just here to kind of spread the word about our company. We're handing out T-shirts and brochures, and pretty much what we do is we get back in the game of life. So, post-operation, pre-operation, sports-related injuries, we just get them back into what they would love to do.
So your facility is located where?
We're here on Woodbridge, right next to the Woodbridge Community Center. We're in that big building next door on the first floor.
So basically what happens is if people have an injury, some type of injury or some type of issue, they can either get a script from their doctor and then come to you, and then you guys will develop a program for them?
Yep, we do get a program for outside in the home, and we get them back pretty much exercises. We do manual therapy. That's
okay. So you can do the therapy in facility, but also you give them some exercises to do back home to help follow up and improve on motion and different things like that, right? Okay. Cool. Well, thanks for coming.
Thank you.
And now at this table, we're here with Janet from Healthcare Quality Strategies. We're going to ask Janet to tell us a little bit about what her program is and why she's here today.
Hi, we're here today because we are contracted by Medicare. We work in the state of New Jersey to educate Medicare beneficiaries about how to better take care of their diabetes condition. We offer a 6-week workshop. We are trying to work right now at Woodbridge. We were just at the Evergreen Senior Center for 6 weeks. We graduated 19 seniors through our program, and we talk about all kinds of things. We talk about nutrition, we talk about exercise, we talk about communication, how to talk to your family, how to talk to your healthcare provider, and we talk about the emotions that come along with having a chronic illness. So it's really nice because it's a workshop. Everybody participates, and they learn from each other. They make some new friends, and it's all free, and they get a free book paid for by Medicare, and it's been very successful.
Okay. So great. So you have a program, and you have qualified people to teach the program, and it's how many weeks long is that program?
It's 6 weeks. It's about 2 hours. So if we meet on a Monday afternoon, we'll meet 6 Monday afternoons. The program was created by Stanford University, so it's tried and true. It's in 20 other countries, and it has been. Also, we work with the Department of Health. They also offer this for chronic illness.
Right.
We are only offering it for diabetes.
Okay. Obviously, diabetes is a type of chronic illness, and so the goal of this program is to help people live a more active, healthy, more rewarding life with the illness.
Right. To help them make any self-management changes, either in their activity, their diet, their health care. It's to get them to a little pat on the back to move them forward.
Okay, well, terrific. Well, thank you for coming today.
Thank you.
We're here with Harry from the Medicine Shop. Harry, thanks for coming today. Tell us what you have here today, and tell us a little bit about what you do.
Oh, well, thank you for having me here. I'm here also, definitely for the community. There's a lot of things that people don't need, really don't know about, like the free vitamin program that we offer. We've been offering that for at least 5 years. Now we extended it to seniors. We used to only do it for children up to the age of 12. Free vitamin for all the way up to the age of 12. But now we have a senior vitamin program that's 50 and up that you can get it for, lifetime. You don't have to, I don't have to run it through insurance. It's free from Medicine Shop in Woodbridge, and we call it the vitamin program.
Wow. That sounds like a nice, terrific program. So if they were interested in that program, what would they need to do?
You come into the store, say, I heard that you have a free vitamin program. If you're a resident in Woodbridge, we're good to go. Terrific. I'm also thinking about also doing this new program. We call it's bingo carding, right? And what it is let me just move this over here. If you're tired of doing pill boxes, or if you have caring for someone like a neighbor or a loved one, and you're doing their pill boxes, and all of a sudden the pill boxes, the dreaded pill box falls and all the pills go all over the place. You do a 52 pickup. And then the pills get all destroyed or they're dirty. And then you go into your local pharmacy or your mail order pharmacy, and you call them up. You say, hey, I need more pills. And they say, well, you're too soon. Therefore, you have to pay full pocket. And a lot of these medications are a lot of money.
Right.
But with this device I have here, stops that from happening. One, we do an AM pill, bingo card, and all the pills go in one AM bingo card. Right, it's a 31-day supply, and also, say for instance, if you're going in the morning before work and you want to get grandma, grandpa, or a neighbor that you're helping out, and you're on the system, you punch out the number that's coordinated on the calendar, right? And you put it in a bottle, a little cup, and you say, "Oh, Ann, or the one that you're helping. Here's your AM pills," and then you could go to work.
Right. So this is a nice way to keep all the pills organized, because now you have all these. You may have a number of different medications, but they're all in one little pouch. You pop them out. You know which ones you need to take in the mornings. You know which ones to take in the afternoon. It keeps it nice and organized.
Absolutely. And
Terrific.
the one thing that we don't it's the one that you care for, but we also have to consider the caregiver. All right, without the caregiver, the one that they're taking care of is going to suffer.
Right.
This will help the caregiver dramatically, and this is free of charge.
So it helps the patient, but it also helps the person who's making sure the patient is taking their proper medication on a regular basis.
Yes.
It makes it easy for both.
Absolutely.
Great.
It's an all-around access to better quality of life and health.
Terrific. Well,
and it's free of charge.
Terrific. Thanks, Harry.